Hello everyone and welcome. Today we are diving deep into the world of porphyria, a really fascinating and often tricky group of disorders. Now for you as a future medical lab professional, understanding how to diagnose these conditions isn't just interesting, it's an absolutely essential skill. We're going to break down the key lab tests that help give patients and their doctors the answers they desperately need.
And hey, as we jump in, a quick heads up. Welcome to the Bioscan Hub channel. If you find this explainer useful for your studies, and I really think you will, please do us a huge favor and hit that subscribe button. It really helps us keep making more detailed content just for students like you.
All right, here's our game plan for today. We're going to start with the absolute basics. What are porphyrins and what exactly is porphyria? Then we'll get into our two main diagnostic tools, the FEP test and porphyrin fractionation, and crucially, how to make sense of the results. And we'll wrap it all up by connecting the science back to what matters most, patient care.
Okay, let's lay the foundation. Before we can even think about diagnosing a problem, we've got to understand how things are supposed to work. And at the very heart of this whole story are these molecules called porphyrins.
I want you to picture a factory. Inside, there's a really important assembly line that's building a critical component called heme. Well, porphyrins are all the different parts created along that assembly line. And that final product, heme, it's unbelievably important. It's the core of hemoglobin that carries oxygen in your blood, myoglobin that stores it in your muscles. It's a total powerhouse.
So, what happens if that assembly line breaks down? Well, that's porphyria in a nutshell. Think of the enzymes as the workers on that line. If one of those workers is missing or isn't doing their job right, the parts they're supposed to work on just start to pile up. It's this abnormal buildup of porphyrin parts that causes all the problems we see in these diseases.
Okay, so we've got a potential problem in our factory. How do we, in the lab, figure this out? When a doctor suspects porphyria, one of the very first tools we reach for is the free erythrocyte protoporphyrin test, or as we call it, the FEP test.
The idea behind this test is actually pretty clever. Even a perfectly running factory has a few spare parts lying around. The FEP test is designed to measure this small, totally normal excess of porphyrin inside red blood cells. But if there's a problem, like you're running out of iron, which is the very last piece needed to complete heme, then the last intermediate part, protoporphyrin, really starts to accumulate. The FEP test is built to spot that specific pileup.
All right, for all you future lab pros out there, listen up, because this is huge. The procedure itself looks pretty standard, right? But look at step 2. It's not just a suggestion, it is absolutely critical. Porphyrins are incredibly sensitive to light. The second that blood is drawn, that tube has to be protected from light, usually with foil. If you don't, the result can be falsely low and you could miss a diagnosis. And also notice step 4. The result depends on the volume of red cells, so you have to know the patient's hematocrit to get the math right.
So, we've run the test perfectly, we protected our sample, and we have a number. Now for the most important part, what does that number actually tell us about the patient?
In general, we consider a normal FEP to be less than 100 micrograms per deciliter. But, and I can't say this loudly enough, you must always check the reference range for your specific lab. Different methods can have slightly different ranges, so always go by your lab's official procedures.
And then we have this, the critical value, anything over 300. Now, in the lab, critical value is code for drop everything and act now. A result this high signals a major problem, like severe iron deficiency or even lead poisoning. It means you have to get on the phone and communicate this to the doctor immediately.
And this is where the FEP test really shows its value as a diagnostic tool. Imagine you have two patients, and they both have a similar type of anemia. If one has a high FEP, you're immediately thinking iron deficiency or lead poisoning. But if the other patient has a normal FEP, that points you down a completely different path, maybe towards something like thalassemia minor. See? It's a crucial fork in the diagnostic road.
Okay, but let's say the FEP is high and we really do think it's a true porphyria. Well, we need more information. We need to dig deeper, and that's where our next test, porphyrin fractionation, comes into play.
So, if the FEP test tells us that there's a pileup on the assembly line, fractionation tells us exactly which part is piling up. This test literally separates and measures the main types of porphyrins, protoporphyrin, uroporphyrin, and coproporphyrin. By figuring out which specific part is accumulating, we can pinpoint which enzyme, which specific worker, has stopped doing its job.
So how do we take these super detailed results and actually name the disease? This is where we go from screening for a problem to confirming a very specific diagnosis.
Okay, take a look at these normal values for porphyrins inside red blood cells. You'll see that protoporphyrin has a pretty wide normal range. But now, look at uroporphyrin and coproporphyrin. They're supposed to be incredibly low. We're talking less than 2 and even less than 1. This is the key takeaway. Any significant jump in these two is a massive red flag that points to a very specific problem on the assembly line.
Now it's like detective work. By looking at which porphyrin is high and where we're finding it, is it in the red cells or is it in the plasma, we can start to name the disease. For instance, a huge spike of protoporphyrin inside the red cells, that points right to a condition called Erythropoietic protoporphyria. But if the problem is mostly in the plasma, we might be looking at something totally different, like Porphyria cutanea tarda. Each pattern is like a unique fingerprint for a specific disease.
All right, let's bring this all home and connect it back to the patient. Because a correct diagnosis from the lab isn't just about getting the right answer on a test. It has huge, real-world impacts on how a person manages their health and their life.
This is a perfect example. Our lab results directly lead to this crucial piece of patient advice. In some types of porphyria, those porphyrins that are piling up actually build up in the skin, and they are photosensitive. When sunlight hits them, it can cause awful, painful blisters and skin damage. Our diagnosis gives the patient the knowledge they need to protect themselves.
And for patients with the acute types of porphyria, the ones that cause severe neurological symptoms, our diagnosis is like a vital warning system. They learn that they can have these horrible attacks triggered by everyday things like an infection or even fasting, but one of the most important things they have to avoid is a whole list of medications.
And this list includes some really common drugs. You see barbiturates, estrogens, even alcohol. So why are these so dangerous? Well, a lot of these drugs rev up an enzyme system in the liver that needs a lot of heme to work. This puts a massive demand on that heme assembly line. In someone with porphyria, their already broken factory line gets pushed into overdrive, causing a huge, sudden pileup of porphyrins and triggering a potentially life-threatening crisis.
And the list just keeps going. Certain antidepressants, blood pressure meds, common antibiotics, they can all stress that heme pathway. This just shows how a single accurate lab diagnosis can completely change how a patient has to approach their own healthcare. It makes them an active partner in keeping themselves safe.
So let's end on this thought. We've talked about tests and numbers and all the science behind it, but it all starts with one tube of blood. That simple act of taking a piece of foil and wrapping it around that tube, that's the first step. That single action ensures an accurate result, which leads to the right diagnosis, which leads to the right patient education. So the next time you handle a specimen in the lab, just remember that your care and your diligence directly impacts a real person's ability to live a safer, healthier life.